Hey guys, this is Dr. JT, MD General Medicine and a rheumatology resident and a part-time YouTuber, and I welcome you to my channel Dr. JTM. So all over India, all universities have given their timetable or exam date specifically for the final theory exams, and they will be from September, October, most probably by November everything will be completed. So in this video I will be helping all the PG residents, specifically general medicine PGs, on how to prepare for these final theory exams and get through it. This video will also help the other branches. So please do watch it till the end. You will get an idea on how to prepare the timetable, how importance to be given for each paper, and how you can study with all the limited time and resources that you have. So don't miss anything. Subscribe to the channel. So firstly, I will reduce all your attention by saying one sentence. It is very easy to pass the theory exams. You might feel that his theory exams got completed, he passed, so he is telling this statement. Yes, but at the same time, when I am preparing for my theory exams, I am shit scared and I'm really afraid. I am very much tense how I'm going to prepare or how I'm going to write the exams, or will I even pass. There are few universities which purposefully will fail the students by giving tough papers or by strict corrections, or there are some students who really don't study at all. They only just touch the books or looking into few topics and go to exam. Those will fail. But in reality, you should be very strategically preparing for these theory exams and write in the exam so you can pass easily. Most of the times the corrections will be fine enough to pass, but at the same time, how you attempt the question, how you elaborate the answer, what it is needed for the correctioner to see in your paper is very important, and I am going to tell that. And by the way, did I say it is easy to pass? Just pass? Yes. Why did I say just pass? Is that theory exams doesn't define you really whether you will become a good surgeon or good physician. Theory exam is just a pathway or a gateway for you to get the MD degree to practice. All it matters is that your confidence in your own skills, the medical knowledge skills or the surgical hands-on skills. So that will define who you are or how good doctor you will be. So don't worry that if you get so less marks or if you get a gold medal in the university in these theory exams, you will be the best doctor. That won't really define you. But if you do well in the practical exams, that will really boost your confidence by the time you come out of the college or the hospital. So for the practical exams, I will do another video on how you can really do your best in the practical so you get all the confidence. But for this, I'll only be talking about the theory exams. So done with all the motivation part and the reality and practicality, but now let us get into the plan and what to study and what not to study as well. If you guys are having a ward off for preparing or preparation holidays for these theory exams, it is really easy for what I'm going to say, but doing duties and preparing for the final theory exams is dead tough. But even though, let us try on how we can manage that. So basically what I did is I got a solid 3 months of ward off for preparing for my final exam. So I used to study for at least 10 to 12 hours. But the point is, studying 10 to 12 hours for a theory exam, just go on reading the textbook or the notes that you have, or few people started watching Marrow and Prep Ladder for their final theory exams. I pity you guys. But anyways, what I did is, first of all, the paper 1 part and paper 4 part, which is really tough to handle and tough to attempt as well, because in the first paper they will be asking basic sciences. Basic sciences means you'll get questions from anatomy, physiology, biochemistry, pathology, microbiology, pharmacology, whatnot, everything that you have studied in MBBS first year and second year, and recalling everything of that is really tough. Or if you start studying those books now, your time won't be sufficient. So what you need to do is very important. What you need to focus in the anatomy, in the physiology part, in the pathology part, or in the microbiological part is really important. So what I did is that I have collected all the question papers of my university in the previous 5 years final theory exams, and also the internal exams that they will conduct every in the first year or the second year, internal exams that will be conducted by your college or by your university. The first paper, collect all those papers for the last 5 years. Just make a list of all those questions. Most of the times 70% of the times repeat questions or the repeat topics will be asked. At least you will know what are they actually touching in the basic sciences. First thing. Second thing you need to do is take the Harrison book. You have first 10 chapters of basic sciences, that is approach to pain, approach to fever, thermoregulation, blood supply to spinal cord, pathway for vomiting, and visual pathway, special senses. These will be there, and you need to study those also, because those first 10 chapters are basic clinical approaches that you need to know in your first year itself. So they will be trying to ask from those areas as well. But many people might think, now if we start studying Harrison, it is very difficult for us what to focus, what not to focus in the basic sciences part. So for every one of you, for any university, what I made is I have collected few set of questions, or I would say few set of topics for basic sciences, and I made it into a PDF. If you want that important topics list PDF, just message me on Instagram as hi JT, I wanted important topics for basic sciences with your email ID. I will definitely send you that. And next, what I did, I completed this particular basic sciences, all the topics which I have made a list, the important list, and also the first 10 chapters of the Harrison. I made a notes, as well as I completed that within 20 days. Don't give more than 20 days, because you have only 2 months or maximum to maximum 3 months. So 20 days for the basic science. If at the end, after studying everything, if you have time, you can come back to this paper. Then you have to go to paper 4. What I did for paper 4, again, paper 4, 50% of the questions will be the latest advances and recent updates. Will it be easy to find those questions? Very, very, very difficult. So first thing what I did is I got this medicine update book. So for every year, I guess every 2 years or every year, they will be publishing this API updates of medicine. So this book will have 2 volumes, and you can study topics very, very commonly asked from the updates from that particular book, or try to find the question papers from your university library or from university website and download them. And paper 4 question, 50% recent advances from the last 3 years. 3 years is enough, and 3 years you just study them. Then in the recent last 1 year, what are the updates, drug updates, any management protocols, particularly they will be asking the management protocols. Again, for the recent updates, I have made a short topics list for which you can prepare from that. And again, you can ping me on my Instagram with your email ID. I will be sending the list of updates or recent advances, like AI updates in management in the heart failure recently, and what are the management updates in asthma. Jinnah updates in 2025 has released. So updates like that in diabetes can be asked as your question. So I have made a list of that as well. So ping me, I'll be sending you that. So now for paper 4 as well, you just give 20 days maximum, and that will be enough. So 20 days of recent updates, whatever questions or topics that you have gathered, just prepare from that. In these 20 days, it is better you study miscellaneous topics like then pregnancy related questions in general medicine. Then you have some patient related consents and all. There are some basic global medicine kind of stuff, social medicine kind of stuff will also be there in this Harrison in the last few chapters, I guess, and you have to prepare from that if you have time. Then will come the 20 to 30 days where you need to study the systemic part, and in systemic most of the times they will be stressing 3 important systems. I have seen many university exam papers where they have stressed CVS, CNS and renal. Most probable questions are coming, like 30 to 40% of the questions are coming from these chapters. So don't miss them, start with them, and you have to know what topics you have to leave in these systemic chapters, that is paper 2 and paper 3. One more important point is that in paper 2 and paper 3, you will definitely get any question from any system in any paper. That means in paper 2, we have 8 to 9 systems. Any question from these 9 systems can be asked in paper 2. Again, any question from these 9 systems can be asked from the paper 3. It doesn't mean that once a CVS question is asked in paper 2, they won't ask in paper 3. I have seen few universities, they have asked CVS in both paper 2 and paper 3. So you have to always study systemic for both paper 2 and paper 3. So you always have to know what to leave, because it is so huge and vast for medicine, guys, that you can't really complete all the 9 systems, and then you have to revise again, of which the biggest one is infections and CNS, CVS and renal. So these 4, it is very difficult to complete. So what I did is that I have made a mini Harrison for you guys, and this mini Harrison will have all the basic sciences of volume 1 and systemic chapters in volume 2 and volume 3. So this is completely of 650 pages book, which I have written for from 21st edition of Harrison for my particular exams as well. I prepared this in such a way it will be helpful for both theory exams as well as for NEET SS exams. I think this will be the most key because I studied this, revised this for like 2 to 3 times and gave the exam, and I got really good marks. Only thing you wanted is to pass and also have a simultaneous orientation for your NEET SS exam. This is your book, because for NEET SS, apart from reading from this, I also practiced MCQs, but this is the key where Mini Harrison, because everything that will be asked in NEET SS will be from Harrison, and if you write answers from Harrison, definitely you will get really good marks. So those people who are studying Matthews, Davidson or some other random textbook for just theory exams, and definitely you will not have confidence after writing theory exams, you will forget everything, because whatever you need to practice should be from a management side of a management point of view, it should be from Harrison. So don't miss in getting this Mini Harrison. You can get this Mini Harrison from my website www.drjtm.com. it is very low cost. In the last few days to your exam and for NEET SS, that will be your key to success or key to pass the exam. So go get it. And for this systemic part, you have to give 20 to 30 days. Those who already started preparing from the main Harrison book, it is very good. If not, take this Mini Harrison, complete it in 20 to 30 days. You will have last 10 to 15 days where you can revise everything again and again. So this is the best chance you can go study, prepare confidently and write the exams, and even after that you will have all the confidence. So don't miss it, go get it. And one last point that I wanted to say is in the last 2 to 3 months, many people, many PG residents from general medicine wanted to have theory classes, Harrison based theory classes. So if you want those Harrison based theory classes from me, I'm ready to help you guys. So just comment down who all are ready to have these theory classes for free on YouTube, or specifically only for you one-on-one. Then just ping me on my Instagram. The Instagram link or Instagram ID I have given in the description. Go and just ping me. I'll always be ready to help you. Or those people who are struggling to start or doesn't have a plan or a schedule and wanted a specific or a specialized plan only for you, study plan, then I am ready to help you again. And if you have any doubts on preparation, you can comment here or ping me on my Instagram. And that's it for this video. I'll be back with one more video. Until then, this is Dr. JT signing off.